Hi, I'm Dr. Jim Moravek. I'm a shoulder and elbow and sports medicine surgeon at Mid-America Hand to Shoulder Clinic. I'm going to talk to you about rotator cuff tears today. Briefly, rotator cuff involves four muscles in the shoulder: supraspinatus, infraspinatus, subscapularis, and teres minor. And these tears happen oftentimes in people who use their shoulders commonly for overhead activities, and these tears happen in an age-related fashion. We quote about 10% of people over 50 have these tears, and that increases as decades to about 50% of people over 80. Commonly, these patients will present with pain in their shoulder, night pain, and weakness in doing overhead activities. And that's what often prompts you to see a physician. When we talk about rotator cuff tears, this can be broken up into several different spectrums of disease. This ranges from people who have tendinitis or an impingement syndrome in their shoulder, going to partial thickness tears, full thickness tears, and massive tears. These are usually diagnosed by MRI or ultrasound, and the treatment for each of these can vary. We usually begin with physical therapy, possibly including an injection for those patients that have tendinitis or a partial thickness tear. And that can allow the other muscles that aren't torn or involved to help compensate for the muscle that's involved. As you get to the full thickness tears, it's sometimes difficult to get these tears to heal on their own. So what we'll often do is we can try therapy to get the other muscles to compensate and get rid of your pain, but some of these patients will oftentimes end up needing surgery. When we talk about surgery for these full thickness rotator cuff tears, we talk about either a mini open or a arthroscopic procedure. Arthroscopic being minimally invasive, using the camera and instruments through tiny incisions in your shoulder in order to get that tendon to heal back down to the bone. When a patient has a massive rotator cuff tear, treatment then becomes very different, and that varies a lot based on your surgeon and what he can come up with in terms of either repairing it, doing a tendon transfer, or even going so far as a shoulder replacement of some form to help your shoulder function and be pain-free. Post-operatively, your treatment will vary depending on the condition you had prior to surgery. First, you'll start with a period of immobilization in a sling, followed by range of motion activities and eventual strengthening, all guided by a skilled physical therapist. In summary, rotator cuff tears are very common. They don't all need surgery. It's our goal as physicians and surgeons to find out what's the optimal treatment for you as a patient to get your shoulder pain-free and back to the best function possible. For more information and to see more educational videos, please go to handtoshoulderclinic.com.